Welcome to This Explainer. Today, we're diving straight into the science behind a famously sensationalized microscopic organism, the notorious brain-eating amoeba. You know the drill, right? Every summer, those terrifying headlines pop up, making us want to just swear off lakes and rivers forever. But today, our goal is to separate fear from reality. We're going to look closely at what this organism actually is, how it operates, and most importantly, how you can easily protect yourself. To set a reassuring tone right out of the gate, I want you to think about the number 4. Why? Well, despite the hundreds of millions of swimming trips taken in the US since 1962, there are only 4 known US survivors of this infection. Now, obviously, every single case is an absolute tragedy, but that number really highlights its extreme statistical rarity. It's an incredibly rare phenomenon, and keeping that perspective in mind is totally key as we explore the biology today. All right, Section 1. Let's meet the amoeba, beyond the headlines. So the clinical name for the resulting infection is PAN. That stands for Primary Amoebic Meningoencephalitis. That's a mouthful, so let's break it down. It's what doctors call a fulminant, meaning sudden and severe, central nervous system infection. The actual culprit is Naegleria fowleri, a thermophilic or heat-loving, free-living amoeba. Basically, once it gets where it absolutely shouldn't be, it destroys brain tissue and causes fatal brain swelling. But to understand how it even gets there, we first need to look at where it naturally hangs out. This little guy is found all over the globe, naturally thriving in its true home, warm freshwater lakes, rivers, and hot springs. It absolutely loves the heat. Because of this, recreational water-associated infections happen almost exclusively during July, August, and September. During those peak summer months, prolonged heat waves cause water temperatures to spike and water levels to drop, which creates literally the absolute perfect breeding ground for this heat-loving amoeba. Now, before we go any further, we need to clear up 2 massive misconceptions. This is super important. You cannot get this infection from swallowing contaminated water. If you accidentally gulp some lake water while swimming, your stomach acid completely neutralizes the amoeba. No problem at all. Plus, the amoeba cannot survive in high salinity environments, so you are never going to find Naegleria fowleri in the ocean or saltwater. Moving on to Section 2, how infection actually happens, the pathway. So for an infection to happen, it requires a very specific mechanical pathway. It's really not just about getting wet. Water actually has to be forcefully pushed way up the nasal cavity. Think jumping off a dock, diving, or wiping out while wakeboarding. Once it's deep inside those nasal passages, the amoeba physically attaches to the olfactory nerve fibers. Then, it uses those fibers like a highway, traveling through a highly porous bone at the base of the skull called the cribriform plate. This grants it direct, completely unrestricted access to the brain's olfactory bulbs and the forebrain. And once it arrives in the brain, well, the amoeba needs food. It feeds on nerve tissue through this bizarre biological process called tragocytosis. It literally consumes the brain cells piecemeal, using a unique, actin-rich sucking apparatus called an amoebostome. Crazy, right? As it rapidly multiplies and feeds, the human body mounts a massive immune response, and it's actually this intense, rapid inflammation and the resulting brain swelling that ultimately defines the disease and leads to fatality. Okay, Section 3. Symptoms and treatment challenges. Why does this infection pose such a massive challenge for doctors? Well, the main hurdle is diagnosis. Early symptoms, which usually pop up 1 to 7 days after exposure, are just your basic headache, fever, nausea, and vomiting. These dangerously mimic everyday bacterial or viral meningitis, which leads to precious lost time. But then it progresses incredibly fast to severe neurological issues, stiff neck, profound confusion, seizures, hallucinations, and coma. Tragically, the disease usually causes death within just 5 days of those symptoms starting. Treatment is incredibly difficult, largely because the brain is so well protected by the blood-brain barrier. Historically, an antifungal drug called amphotericin B has been the clinical mainstay. But recently, there's been a glimmer of cautious optimism thanks to aggressive combination therapies. Doctors have started using a novel antiparasitic drug originally meant for leishmaniasis called miltefosine, and they combine this with targeted temperature management, literally cooling the patient's body below normal temperatures to aggressively control that deadly brain swelling. This specific combo has actually been used in recent surviving patients. Which brings us to Section 4, extreme severity, extreme rarity. The numbers here are definitely stark. The global fatality rate is extraordinarily high.
sitting right around 98.5%. Out of hundreds of cases diagnosed globally since the 1960s, there are only a tiny handful of confirmed survivors. We're talking single digits worldwide. But while the fatality rate of the disease itself is staggering, it is absolutely vital we put the actual number of infections into proper perspective.
Think about it this way. There are typically fewer than 10 PAM deaths a year in the United States. In tragic contrast, there are thousands of drowning deaths annually. This comparison reinforces a really critical concept. Yes, the disease is unspeakably severe if contracted, but your actual risk of encountering the amoeba in a way that leads to infection is incredibly, vanishingly low. You are far, far more likely to face other common water hazards. Finally, Section 5, Practical Prevention Advice. Because treatment is so tough, prevention is absolutely your best tool. And demographics actually give us our first major clue. Statistically speaking, young boys are at the highest risk for Naegleria fowleri infections. Why is that? Well, it mostly comes down to behavior. Young boys are just more likely to participate in vigorous, splashy water activities, jumping, diving, and especially playing in the warm sediment at the bottom of lakes and rivers. And that muddy sediment at the bottom, that is exactly where the amoeba is most abundant. So if you're heading out to enjoy some warm, fresh water, the rules are wonderfully simple. The only way to get infected is if water goes forcefully up your nose. So just limit that. Use nose clips or simply pinch your nose shut when you jump in. If you're visiting natural hot springs, keep your head completely above water. Try to avoid swimming during intense late summer heat waves when water levels get super low. And finally, just avoid digging or stirring up that muddy, shallow sediment. Now, we also have to talk about activities away from the lake. For anyone who practices sinus rinsing, whether that's using a neti pot for seasonal allergies or as part of religious practices like ablution, the rules here are non-negotiable. Never, ever use untreated tap or faucet water directly in your nose. The amoeba can actually live in household pipes. You absolutely must rely on store-bought distilled or sterile water or tap water that has been boiled at a rolling boil for at least 1 solid minute and then allowed to cool. By understanding the actual biological science of Naegleria fowleri, we totally strip away its mystery. We now know the mechanics of how it infects, the extreme rarity of it actually happening, and the really simple physical barriers, like nose clips and boiled water, that stop it dead in its tracks. Armed with facts instead of sensationalized fear, we can easily mitigate this incredibly rare risk. Which leaves me with one final thought for you to ponder. Now that you're educated, calm, and fully prepared, how will you safely enjoy your local freshwater lakes and rivers this summer? Thanks for joining me today. Keep learning, stay safe, and have fun out on the water.